So I'm going to show you how to do a newborn assessment. I'm going to begin by doing getting the baby's weight, then doing the head to toe assessment, then I'll do measurements and then administer the newborn medications. So I've already zeroed out my scale with the sling and the blanket. I'm going to weigh the baby. The baby weighs 8 pounds 2 ounces. Okay, then I'll start my exam. I'm going to again go from head to toe, and the whole time I'm going to also be assessing the baby's tone, coloring, maturity level, the quality of their cry, things like presence of lanugo, vernix, birthmarks, or the quality of their skin. Is it saggy? Is it peeling? Those kinds of things. So starting from the head, I'm looking for any molding or capit. I'm checking fontanelles to make sure that they are open and flat. Okay. And then I check the ears. If cartilage is firm, there's instant recoil. They are normal placed. Eyes are also normal placed and symmetrical. I'm going to look in the baby's eyes at the sclera to assess for any redness. Okay, that is fine. I'm going to assess baby's nares by closing one at a time to see if they are still able to breathe, since they are obligate nose breathers. And baby isn't having any trouble when I close them, so they appear patent. Next, I'm going to assess the baby's mouth. First, visually trying to see if the baby's palate is intact. It appears intact, but I'm also going to feel. Feels intact. There's a normal arch. There are no natal teeth. Baby's tongue moves freely. The lingual frenulum does not appear to impede its movement. It can come out past the lip, so I'm not concerned about tongue tie. I'm going to check baby's sucking reflex, which is present and strong. Next, I will assess the baby's neck, which appears normal. There's no masses, full range of motion. I'm going to palpate the clavicles for crepitus, and there is none, so I assume that the clavicles are intact. The shoulders are also even, and I will assess the Moro or startle reflex. Okay, and it is present and equal bilaterally. Moving on to the baby's hands, 5 digits on each hand, no webbing, full symmetrical creases on each hand, good strong grasp reflex. I'm going to palpate the baby's breast buds. They're about 5 millimeters each and equal. Now I'm going to listen to the baby's breath sounds and also get a respiratory rate. I listen in 3 locations on each side. So above the nipple line, below the nipple line, and then under the arm on each side. Below the arm. And then I'm going to listen for 1 minute to get a respiratory rate. The breath sounds were clear. There was no rhonchi, stridor, or rales. Respiratory rate is 43. I'm also listen to the heart. I'm going to listen in 4 different places for the over each valve, the aortic valve, then the pulmonic valve, tricuspid, and mitral. I'm listening for extra sounds or murmurs, and there's none. And I'm going to get an apical rate by listening for a full minute at the apex, and that rate is 138. And there, and then I will move on to the abdominal assessment. So I'm going to listen in all 4 quadrants for bowel sounds, and bowel sounds are present in all 4 quadrants. And I will also palpate the abdomen, and I'm feeling for masses or hernias. I can also assess the umbilicus for the 3 vessel cord. which is present. I'm going to feel the femoral pulses, which are present and strong bilaterally. I'm going to assess genitalia. This baby has a penis. The shaft appears straight. The foreskin fully covers the glands of the penis and is intact. And the urethral meatus appears in normal placement. And also assess the anus for patency, and that also appears patent. Next, I am going to continue on by assessing the hips. And the hips have full range of motion, no clicks, no slips. Baby's feet, 5 digits on each side, no webbing. Babinski reflex is present, plantar reflex is present, and there's creases down about 2/3 of the feet bilaterally. Okay, then I would move baby over onto their stomach so I can assess their back. Spine is straight and closed. There's no dimples, no tufts of hair, no skin tags. The gluteal clefts are equal bilaterally, as are the creases on the legs. That's another way to assess for hip dislocation. There's no concerns there. All right, now it's time to do some measurements for this baby. Baby's head measures 12.5 inches. Then I will measure the chest. Chest is 11 inches. Then I turn baby onto their side and measure from the top of their head to their heel, just 17 inches. Okay, all right, baby. Now it's time for the newborn medications. I would get consent again from the parents, which they do still want both the erythromycin eye ointment and the vitamin K injection. So I'm going to don my gloves. I'm going to do the vitamin K first. I have already got that drawn up into a syringe. So start by cleaning. I'm going to hold the skin taut, remove cap, and quick jab, inject. I'm going to put this in my sharps container, put a little gauze on the injection site, and I can put a band-aid on there if the parents wish. So that's done. Then the eye ointment. This is a multi-use container, so I'm going to take the cap off. I'm going to waste a small ribbon of ointment. Then I'm going to put about 1/4 inch of ointment in each eye, and I'm careful not to touch the tip of the tube to the eyelid or the eyeball itself. I will waste another small bit, put the cap back on, and if I need to, I can wipe excess off of the baby's face. And that newborn examination is complete.